Mike Maggers, very nice to meet you. Welcome. Okay. At a big county event.
Very, very good paramedicine. Some BLS crews making some scary but good decisions. Scary for them.
Leslie, somebody's probably going to ask you to briefly introduce yourself, so think about how you want to do that. You don't have to sing.
Like, let me just observe, see how this goes.
No, they don't have to do that.
And apparently we didn't have you introduce yourself last time, so somebody might ask you that today.
Okay. I'll try to remember
Okay.
who I am. It's slow.
Oh, it's already 4 o'clock.
I got 403 by a couple minutes.
You gotta use Bill Gates time here.
Bill Gates time will work. Well, my apologies. I didn't realize that the clock was wrong. So, welcome to the Thursday, February 14th meeting of the Emergency Medical Care Advisory Board. We'll call our meeting to order and have our flag salute led today by John Surface. Mr. Surface.
Salute. Pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Please have a seat. Ferris, could you call the roll for us, please?
Yes, sir, thank you. Kathy Prout. Supervisor Maggard.
Here.
James Miller. Here. Leslie Wilmer.
Here.
Scott Hurlbert.
Here.
John Surface.
Here.
Dr. Lyon.
Here.
And Bruce Peters.
Here.
We have a quorum.
Thank you. Mr. Ferris, I think we have one new member and one who it was an oversight on my part that we didn't have him introduce himself last time. So do you want to make an introduction and then we'll let them do that? Or is there another time during the agenda you plan to do that?
I have a plan to do that.
We'll let you do that. Okay. We have a couple of items on consent, item number 5 and item number 12. Consent items are considered to be routine by staff, and they're usually voted on all at once. So does any member of the public have a question or a comment about either of those items on consent? Okay, is there a motion then to approve the 2 consent items?
So moved.
Is there a second?
Second.
Anybody have any other comment? All in favor, please say aye.
Aye.
Aye. Is anybody opposed? Very good. Thank you. We have no subcommittee reports today. That's number 6. Item number 7 is public comments. This portion of the meeting is reserved for persons desiring to address the board on any matter not otherwise on this agenda and over which the board has jurisdiction. So members of the public will also have an opportunity to comment on each agenda item as it comes up as we deal with it. Are there any members of the public that would like to address us this afternoon about any matters not otherwise on our agenda? Okay. Thank you. There are no requests from the public to speak about a specific item and no unfinished business. So we move on to new business, and item 10A on page 2 of your agenda is an MCAB member update. And I suspect this is when Mr. Ferris will do what I called upon him to do. So, Mr. Ferris, why don't you take the lead there?
Thank you, Mr. Chairman. The following are new appointees by the Board of Supervisors. Mr. Scott Hurlbert from the City of Shafter has been appointed as the member of the Kern Mayors and City Managers Group. This is actually his second meeting with us. I did not introduce him last time at his first meeting, so welcome, sir.
Thank you.
Greg Garrett from the City of Tehachapi has been appointed as the alternate to the Kern Mayors and City Managers Group. He is not presently here, but whenever Mr. Hurlbert can't make it, Mr. Garrett will be here. Leslie Wilmer from Taft has been appointed as the member to the Rural Consumer Group. Welcome.
Thank you.
And John Sizemore from Bakersfield has been appointed as the alternate to the Urban Consumer Group. Now you have it back. So I would like to take this opportunity to welcome each of you to MCAB and to thank you for your service to the community. Therefore, I recommend that the board receive and file this report.
Thank you. Leslie, is there anything you'd like to tell us about yourself?
I'm just Leslie Wilmer. I am from Taft, of course, and I'm just here to give a service of what I could do for the city of Taft and other communities just to see how everything goes. So, because due to Taft, we don't have an emergency room or anything like that, so we depend on this.
Well, thank you, Leslie. We're glad you joined us and look forward to your opportunity to serve with us. Scott, anything you want to tell us about yourself?
Actually, take this opportunity to let folks know about the Kern Mayors and Managers Group. A lot of folks aren't familiar with that, but it's we get together approximately monthly, at least scheduled monthly, and it is made up of what it sounds like. The city managers from all 11 cities here in the county, and the mayors, whoever is currently serving as mayor. And the group's been revitalized here in the last 2 or 3 years, and we get together and talk about common interests. We also are working on our emergency response plans with county EMS services, or county with Georgiana, and to get our emergency plans in sync. So it's a great group, and I'm glad to represent them here.
Good. Well, thank you. Welcome to you as well, Scott. Are there any members of the public that would like to make comment about this member update? Then it is recommended, and we should not adopt, but receive and file that report. Is there a motion to receive and file? Thank you. Is there a second?
Second.
All in favor, please say aye. Aye. Is anybody opposed? Thank you. 10B is an EMS restructure, and it will receive and file that in a moment. And Mr. Ferris?
Thank you, Mr. Chairman. EMS provides a vital and important role in our county by assuring the proper treatment and transportation of our citizens on a daily basis. Over the past decade, Kern County EMS has gone through many changes. In 2010, the EMS department became a division of public health under the direction of the Board of Supervisors. Since then, EMS has gone through many staffing and position changes and entered into an era of evolution. For the past year, a process has been underway to reorganize EMS in an effort to better reflect the needs of our community and improve the way we do business. EMS has shifted from a division to a program of the Public Health Department, allowing for streamlined communication, guidance, and backing for EMS. Structural changes have been made that include the creation of a program manager position responsible for the day-to-day operations and oversight of the EMS program. Currently, EMS is working on filling a vacant EMS coordinator position, which will assist in the oversight of the system and provide for continued improvement of our processes. With these changes in structure, EMS can move forward into 2019 with a renewed focus on improving our system to better serve the community. That's the conclusion of my report. It is recommended that the board receive and file.
Thank you. Are there any questions by members of the board?
I think we should make a comment that Mr. Ferris was promoted to the manager position and Mr. Baker was promoted to the senior position, and I'd like to offer them my congratulations.
Yay.
Congratulations to both of you. Sometimes we give congratulations with condolences. What you will have to face. Do any members of the public wish to make comment about it? Is there a motion then to receive and file? Motion. As a second?
Second.
Thank you. All in favor, please say aye.
Aye.
Thank you very much. Next is item 10C, an MCAB bylaw update, and this is going to be presented by Jeff Ferris as well.
Thank you, Mr. Chairman. With the changes that we just discussed to the EMS organizational structure and the addition and deletion of several positions, it became necessary to update the MCAB bylaws to reflect those changes. The bylaws were updated to reflect the new position names and references to the EMS division itself. References to division were changed to EMS or program, and references to the director were changed to manager. No substantive changes were made to the document, only changes to specifically named positions and the word division itself. These changes bring the bylaws up to date with the current EMS structure. Therefore, it is recommended that the board approve the MCAB bylaw update. That completes my report.
Thank you. Any questions of Mr. Ferris about that? Do any members of the public have comment? Okay. This one is not only to receive and file, but also to approve the changes to the bylaws. So is there a motion to approve and then receive and file?
Motion.
Thank you. Is there a second?
Second.
All in favor, please say aye.
Aye.
Aye. Any opposed? Thank you. Next is a Maddie Fund report, and this is going to be presented to us by Bryn Kerrigan. Hi, Bryn.
Good afternoon, Mr. Chairman, members of MCAB. My name is Bryn Kerrigan. I'm the Assistant Director of Kern County Public Health. The item before you today is a report on changes of the use of the discretionary funding within the Maddie Fund. On October 9th and December 4th, 2018, the Kern County Board of Supervisors approved changes to the EMS program's fees. The EMS program is designed to be 100% fee supported, as it does not receive any general fund resources. However, since fees had not been adjusted since 1999, the program was relying on Maddie Fund to cover operational costs. As part of the approved changes to the EMS program fees, the department has freed up the discretionary portion of the Maddie funds that were previously used to fund operations. This funding will now be used, as intended by the legislature that created it, to fund enhancements in the EMS system as approved by your board. The discretionary portion of this funding is trending to be about $50,000 each quarter. However, please note that Maddie Fund is a very variable funding stream. EMS staff will report the available balance of the discretionary funding as of the previous quarter ending at each MCAB meeting. The request for funding will work as follows. Anybody can request the funding for a system enhancement, but the request must be made either in writing or as a public or board member request at an MCAB meeting. If an MCAB member feels the request is worthy of consideration, that member will make a motion to refer the request to EMS program staff to evaluate the requested items and/or services and report back to MCAB. MCAB will then vote at the following meeting whether or not to fund the request based on the staff report and input from MCAB members. If funding has been approved, implementing agencies will be responsible for purchasing the items and/or services and then will submit the invoice for the purchase to the EMS program for reimbursement. Mr. Chairman and members of MCAB, that concludes my report. I'm available for any questions you may have.
Thank you. Are there any questions for Ms. Kerrigan?
So I have a question, Mr. Chairman.
Okay.
So what you just reported is, have these discretionary funds been used in this fashion previously? What you reported on?
So they've only been used to fund operations of the EMS program.
But this is not a change to what you've been doing, or it is?
It's not this is a change to what we've previously been doing. This funding is now available for MCAB to decide how we can improve the system overall, not our program as it operates, but the EMS system. So if we want to implement something at the hospital level or with the ambulance companies, then that request can be made to MCAB and that funding can be used to make those enhancements.
Okay, so noting on the last page of our packets on the distribution of the funds, what columns does that fall under? Does it change any of the other percentages applied to, say, the physicians or the hospitals or anything else under this document?
It does not change any of the other allocations to the individuals that are already receiving the funds.
Okay, all right, thank you.
You're welcome.
Dr. Lyon?
I think this would be an opportune time to make a request from AMCAB for use of these funds. We have discussed extensively over the past probably several years. I sound very loud. So
It's
I
not
would,
that loud.
no? Okay, maybe it's just in my head. So I'd like to make a request that we move forward with implementing the hand-heavy system. For those of you who are unfamiliar with hand-heavy, it is a system that was developed by a pediatric emergency physician and EMS physician, Peter Antevi. He's an EMS physician in Florida, works for several EMS systems, fire departments, as well as a pediatric emergency physician. This was developed to simplify pediatric dosing. It eliminates weight-based dosing calculations and provides seamless volume-based dosing. So this means that the paramedics don't have to make weight-based calculations, convert that to a volume, and figure out how much volume of a medication to push. So when you're running a code, this is really critical to try to make things simpler and not have to make calculations that can potentially have serious outcome issues. So this helps decrease dosing errors, improve provider confidence, decrease time to administration of medications, and may improve outcomes. The program includes mobile app-based systems that integrate into current EHRs, including ESO. The program is customized to the local protocols and updated for any changes. It also has an option if the hospitals choose. They also may implement it to help with dosing in hospitals and integrates into their systems as well. There are many EMS systems and hospital systems throughout the country that are already using this with success, and quite opportunely, this came out today in my inbox from the February 29 issue of Resuscitation. It was a study that was looking at the hand-heavy system and outcomes of pediatric out-of-hospital cardiac arrest in Polk County Fire. They had an increase in their cardiac arrest neurologically intact survival. So what that means is these kids went home and were normal, functioning, part of their family, just like they were before. They increased their neurologically intact survival from 0 to 23.2%. they had a ROSC rate, so just increase in pulses back from 5.3 to 30.4%. I mean, these are dramatic increases. And so with that being said, it would cost $32,074.56 for the first year of implementation, with a $9,600 yearly maintenance fee. So I would like to make a request from MCAB that we fund the implementation and regular yearly payment for hand-heavy starting as soon as we can.
So I think we have two questions before us, do we not? First is the issue of making the changes that are recommended to allow us to do something like the request from the doctor. So are there any questions about the process of adopting what's necessary so we can make allocations such as that? We're not approving that allocation, we're approving the change so that we can make those allocations. Any questions about that? How about by members of the public?
I guess the only question would be, based on what you outlined, would we have to wait till next quarter to vote on it, since we already have looked into this pretty in depth? So,
Mr. Chair, I would argue that we need to keep the 3 months there. I think it's important that we have discussions after something comes to MCAB. I think that 90-day protection is important.
okay.
And I would support the recommendation. I'll make a motion to approve the recommendation as is.
Okay. Do I understand correctly, Ms. Kerrigan, that the Maddie allocation is $99,203? Is that the next to last column? Is that how much we have a year to spend?
Mr. Chairman, that is correct. That is accounting for only 2 quarters of this year so far, but yes, as of now, we have 99,000 in that category to allocate.
So does it grow at a flat rate? Will it be double that if there's 4 quarters?
It trends approximately that same, so we can pretty much anticipate that we'll see about $200,000 per year in this category to allocate, but it is a very variable funding stream.
Okay. GK is, I don't believe I realize I'm mixing issues here, but the second issue that we're going to talk about, which is the request from Dr. Lyon to make this allocation, that's not agendized
Correct.
today. So does that mean we cannot make that decision today?
That's correct. It hasn't
Okay.
been agendized. There's no opportunity for the public to evaluate the proposal or have public comment. So that would need to be agendized and published as a part of your agenda.
Okay, so
Would we be able to make the request to agendize it for
Yes.
the next meeting?
Yes.
Thank
So we'll come back and make that request with you in just a moment. Okay, so the first issue is giving us the authority to be able to make those kinds of allocations. So is there a motion to adopt staff's recommendation?
So moved.
Is there a second?
Second.
Any other discussion? All in favor, please say aye.
Aye.
Anybody opposed? Okay, now, Dr. Lyon, with regard to Dr. Lyon's request, it was 50,000, how much?
It's $32,074.56 for the implementation, and then $9,600 yearly after the first year.
Okay, so I think the appropriate action would be for us to recommend to staff to evaluate that and bring us back staff's analysis of it and pose the question, shall we make that allocation when next we meet? Is that
That's
appropriate?
correct, Mr. Chairman.
Okay, so can you get the particulars from Dr. Lyon about all of that? Okay.
Yes, sir.
Anything else you want to say, Doctor?
No, thank you.
Okay.
Mr. Chairman?
Yes.
I'd also like staff's report to include the actual cost of implementation, training all the EMTs and paramedics. I think it's fair that when we're going to bring a new piece of equipment in, we've got to look at the total cost of ownership, not just the price to buy the new car.
Okay.
I don't disagree with the research in hand-heavy, but we need to look at the total price. As more items are going to come before us in the next several years, looking for funding, we need to know the total cost.
Okay. So it would also seem to me appropriate for, if we now have these funds available, to make it clear to everyone what the process is to tee something up to be considered on how we would spend the funds. So maybe you can make that part of our report next time, okay? Okay, so there's a motion to refer to staff the question as to whether or not we make this designation when next we meet. Is there a second to that motion?
Second.
Any public comment about that?
I just have a question, Mr. Chairman.
We need your name for the record.
Kevin Albertson,
Hi. From Bakersfield City?
Bakersfield City,
Hi.
Potemkin. The Manning
That is correct.
Okay. And if we wanted to do something like that, we just have to submit something, right?
Yes. It might be good to submit it to staff so we can work his way up to come to us with a report. That might expedite it. So, okay, we have a motion and a second to make that referral to staff for consideration the next time we meet. Is all those in favor, please say aye.
Aye.
Aye. Anybody opposed to that? Very good. Thanks for bringing that to our attention. Next is item 10E, and it is Stop the Bleed training, and this is going to be presented to us by George Baker.
One other question on the Manning funding, if we could go back.
We can.
CPAP for the county first responders. I know Dr. Line is looking into that for the fire service, both the city and county fire department. Something that we might want to consider for Manning funding, implementing the CPAP program throughout the county, between the two fire departments and possibly Cal City also.
Sorry if I'm exposing my ignorance, but you mean CPAP as in sleep apnea, so they need CPAP while they're sleeping?
I think Dr. Lyons would probably have a better description of it for us, but.
It essentially the same sort of device, but it's for people that are acutely ill and having difficulty breathing.
Oh.
And it's one of the devices and one of the treatments that has been found to be highly effective and was added to the EMT basics scope of practice.
Okay. Well, it sounds to me like there's going to be a line forming quickly as to how we're going to spend this money. So it would also be helpful to us, I think, when next we meet to have some kind of a recommendation from you about how we vet, how we prioritize. Otherwise, we're going to spend all this money and, you know, who knows what will come the next month. We won't have any money left to do anything with it.
Yes, sir, Mr. Chairman, I will take care of that.
Very good. Thank you.
Thank you.
Mr. Baker. This is item 10E as in Edward.
My name is George Baker. I am the newly minted Senior EMS Coordinator for the EMS program. Accidental and non-accidental, goodness, I'll just use my, non-accidental trauma account for approximately 5 million deaths worldwide each year. It is believed that as many as 20% of these deaths are preventable with immediate bystander intervention and the use of basic bleeding control techniques. The U.S. Department of Homeland Security, in conjunction with the American College of Surgeons and other entities, have developed a national Stop the Bleed campaign to raise awareness and prepare our communities to respond to instances of life-threatening bleeding. Historically, victims of trauma must wait for the traditional EMS system to arrive. Its system response and receive little or no care prior to our responders' arrival. This causes increased mortality and morbidity. The traditional hesitancy of citizens to act at these trauma scenes needs to be addressed and changed through knowledge and training. In response to these concerns, in 2016, Kern County EMS staff began teaching Stop the Bleed to anyone interested in learning. To date, we have trained hundreds of county employees, high school students, members of the community as well. Staff presented the Stop the Bleed program to the Safer Kids Coalition in November of 2018, and as a result, we were invited to train the Wasco Unified School District. We're focusing on educators and support staff. Yesterday, we trained 86 educators and support staff of that school district, and we'll do about 170 total. We have another one coming up on the 27th. Additionally, we were in the final stages of securing corporate sponsors who will donate a cabinet that contains 8 Stop the Bleed kits to every high school in Kern County over the next hopefully 2 years. EMS is committed to providing this life-saving training to educators and staff during this time period to provide a safer environment for our children to learn and thrive. It is recommended the board receive and file the Stop the Bleed report.
Thank you, Mr. Baker. Are there any questions for him regarding the Stop the Bleed training program? How about from members of the public? Okay, is there a motion that we receive and file that report? Thank you. Is there a second?
Second.
All in favor, please say aye. Aye. Is anybody opposed? Very good, thank you. Next is our manager's report. Mr. Ferris?
Thank you, Mr. Chairman. My report just got substantially shorter because I had a section in here about what he just talked about, so we better improve our communication skills. For EMS.
You're the boss.
I know. Exactly. For EMS, the end of 2018 and the beginning of 2019 has marked a continued commitment to engage with and improve our community. The commitment is evidenced by our efforts to providing the training to the community and build our emergency preparedness capabilities. As George just said, we became members of the Kern County Safer Kids Coalition, which allows us to participate in emergency planning, health policy, protocol implementation, and have a voice in keeping our kids safe. The Wasco Unified School District Stop the Bleed training was a direct result of our participation in the Safer Kids Coalition. We are in the process currently of securing donations that will allow for the purchase of the Stop the Bleed cabinets that George just referred to be placed in all the high schools that we provide this training for. If we are able to do this and we're successful, Kern will be the only known county in California that is providing this equipment along with the training. While preparing our youth for emergencies, we were also building our capacity as an EMS system to prepare for and respond to county and statewide disasters. On November 14th, EMS held a full-scale functional exercise. This exercise tested our hospitals, surgery centers, dialysis centers, urgent cares, and long-term care centers on their ability to mobilize and respond to and deploy their disaster equipment and implement their disaster plans. This included the use of our internet communications system, ReadyNet, for resource requests, mobilization of emergency response trailers, and the use of equipment to successfully set up a point of dispensing or a pod. This exercise was extremely successful in meeting the requirements set by the state for disaster preparedness and response. In the coming months, we will engage other stakeholders such as public health nursing staff, local nursing students in disaster preparedness and response planning. Additionally, our EMS coordinators, Kim Tollison and Charles Brockett, are working to improve our Kern Medical Reserve Corps, which has the ability to send volunteers to both local and state disasters. In December, we successfully deployed an EMT from the Reserve Corps to Butte County to assist in the shelters. We were the only county in our region to respond to the request and deploy a volunteer. We will continue working to grow our Medical Reserve Corps membership, hold meaningful member meetings and trainings, and organize drills to assure we maintain our readiness to respond in emergency situations throughout Kern County and California. By working with stakeholders, community members, and public health staff, we hope to expand our ability to respond to and prepare for disasters both at the local and state levels, thus keeping our communities safe. That concludes my report. It is recommended that you receive and file, and I'm here to answer any questions.
Very good. Any comments by the board members about the report? How about from members of the public? Okay, we should receive and file it. Is there a motion to do so?
So moved.
Thank you. Is there a second?
Second.
All in favor, please say aye.
Aye.
Thank you. Item number 12 was dealt with under our consent agenda. So item number 13 is board member announcements or reports. Colleagues, is there anything you'd like to report? You're good? Okay. I have an announcement or two announcements with regard to our next meeting. Our next regularly scheduled meeting is Thursday, May 9th, 4 o'clock in this room. And the deadline to submit public requests for that agenda is Thursday, April 25th, 5 p.m. So you would need to contact our EMS program manager, Mr. Ferris, if there is anything about, in that regard, you'd like to make sure is on there. So with nothing else before us, anything else we need to deal with? I would entertain a motion to adjourn. Thank you. Without objection, so ordered. Thank you very much. Happy Valentine's, everyone. Ms. Wilmer, the next time we meet, you will no longer be a rookie.
Thanks. No pressure.